Welcome to Healthcare du Jour, where we dish up and digest the latest in healthcare. For the next 30 minutes, sit back as we bring you insight, commentary, and discussion on trending topics to the table, all expertly served up by our host and his guests. Healthcare du Jour is brought to you by High Tech Answers and Healthcare Now Radio, part of the Answers Media Network, and is sponsored by the law offices of Myrick O'Connell. Now here is your host, Matt Fisher.
Welcome back, and thank you for joining as we dive into the hottest topics in healthcare. I'm your host, Matt Fisher. On the menu today is Lidia Fonseca, Senior Vice President and Chief Information Officer at Quest Diagnostics. Welcome, Lidia.
Good morning, Matt. How are you?
Doing very well. It's great to have you on the program today.
Good to be here.
So before we kind of dive into our more substantive topics, I always like to give my guests the opportunity to just give a little bit of an introduction as to who they are and what they do.
Sure. So thank you for having me. As Lidia Fonseca, I serve as the Chief Information Officer and Chief Technology Officer for Quest Diagnostics. And, I would say what I do is the typical things you would expect of a CIO, right? Networks, email, data centers, security. But then also, my team and I also do all of the client-facing and healthcare technologies and analytics product development for the company as well.
So have you always been in the healthcare field?
I have been in the healthcare field for a long time and, did spend right after college some time in the entertainment business, the film and video, home video divisions of Sony Pictures Entertainment. But the bulk of my career has been in healthcare.
And being in the healthcare field, have you always been on more of a provider side or a technology side, or kind of come at it from all different angles?
I've been at different angles in healthcare. So, I started with Philips Healthcare, and Philips is in the diagnostic imaging and, that side of things. I've also served for another company that focused on clinical trials with imaging endpoints and patient recruitment for clinical trials. So I've been on that side, really focused and working with pharma companies, right, and providing contract research organization types of services, or CRO services. And, more recently, the last 10 years, I've been focused on the diagnostics, the medical testing and diagnostic side of healthcare. So certainly have been in different angles of the industry.
So kind of coming from that perspective of having been able to see a lot of the different angles and work for companies and in a lot of the different aspects of the industry, what do you see as some of the biggest challenges for healthcare right now?
So, I'm an optimist by nature. So if it's all right with you, I'd like to speak to both the challenges and the opportunities that I see in the healthcare industry.
Oh, certainly.
I would say is that okay? Yeah, on the challenges side, I would say there are a couple things. One, interoperability, has been, a challenge, right, for the industry. Completeness and accuracy of data have been challenges that, all of us in healthcare have grappled with. I would say more recently, with the explosion of data available today, I think consumers and providers struggle with how to glean insights from the sea of data and data points that are available today. So those are some of the, key challenges. I would say on the opportunity front, healthcare, is shifting from volume and consumption to value and quality. And so we're going from a siloed and uncoordinated care to a healthcare environment that is consumer-centric and enabled through care coordination and transparency. If you step back from it, right, we're shifting from treating the sick to keeping people well. And so that's kind of how I see the landscape in terms of the challenges and the opportunities.
Yeah, and kind of as you're describing that, it's really, at least from my perspective a little bit, two sides of the same coin, because as you're talking about the opportunities of shifting from a volume to a value system, that would seem to be a driver for addressing the challenges of, kind of some of the ones you identified of being interoperability or accuracy of the data.
Absolutely. And I think that technology, population health, right, through analytics and extended care services can address both of these challenges and opportunities, right? So I do think that that's I really believe that there's never been a better time to be in healthcare than today. And certainly as a technology and digital and data person, this is, exciting times, right? Because digital services, workflow tools, effective consumer and provider solutions that enable better clinical and economic decisions. And I think that's what's exciting, right? When you think about us as Quest, given the scale and scope of our reach, right? We see 1 in 3 Americans every year are connected with 50% of all hospitals and IDNs, more than 470,000 providers leverage our connectivity and solutions. And we have 40 billion test results in our big data backbone. We can make an impact, right? So that's the exciting part through Quest Quantum, which is our technology and data brand and portfolio. We are offering consumers, providers, and health systems tools to manage the health of individuals, populations, right, to drive better outcomes. And that's through data analytics. And at the same time, you can improve the quality of care and deliver efficiencies. So it's a very, very interesting time. And I think technology and data solutions are really a great fit, for the industry.
Yeah, and actually kind of the point you just made about your experience at Quest, which is, I think everyone would recognize it as a lab company where you go and get your blood drawn and, have lab tests run. But kind of as you were saying, there's a whole nother aspect to your business of the data analytics and the data support. So do you see, in terms of, helping to seize the opportunities that you're identifying, do you see more likelihood of success from companies like Quest that are already in the industry and have all these touch points but aren't necessarily viewed in the kind of analytics light, as opposed to a complete outsider or startup coming in and trying to disrupt the system and succeed?
And that's a great point, Matt. I think I can tell you as a strategy, right? If you think about our vision, right, it's empowering better health through diagnostic insights. And so we very much believe, and we see ourselves as being more than a lab. And in fact, we are in the business of diagnostics information services. And if you think about not only is it enough, and again, we interact with consumers, with people, right, in some of their most intimate moments. And we have a credibility, right, as a healthcare company that's been in business for 50 years. And we've been an innovator in technology, right? So we're very much, as we think about our value proposition into the market, we see ourselves as being more than a lab. And we also believe that healthcare is a team sport. So we also collaborate well to ensure that we're providing, solutions, right? So, when you kind of step back from it, right, through Quest and Quest Quantum, we're driving action from insight. So our analytics help our, consumers and providers effectively make decisions through data analytics. And if you think about that shift from volume to value-based care, value-based means that it's not enough to order a procedure. You have to show that it's going to have the intended outcome, and that can only be achieved by understanding and connecting the dots. So really, data and population health is what really enables those decisions, and then you can prove that the outcomes that we're looking for clinically are happening.
Yeah, and I think you made a very good point in there, which is, as you're saying, you have touch points with both the provider side and the consumer or patient side. Do you see a sufficient amount of focus on really driving interaction and collaboration with both sides at this point in time, or is more work needed?
It's interesting you say that because, one of the things that we recognize as a company, right, in our business, that if you look at our industry that we participate in, the consumer, right, the consumer of our services is not necessarily the one that orders our services, because that's the provider. And it's also not necessarily the one who pays for the services, because that's going to be the payer or the employer. And so, one of the things that we have recognized is we have these different audiences, right? Consumers, providers, hospitals, health systems, and also the payers. And the payers can be insurance companies, and they can be employers, right? That are the ones that, sponsor and pay for the care. And so part of us, the solutions that we provide, if you think about these different audiences, right? It's really, so for example, we can provide insights that can really identify, for example, the risk of a patient or identify gaps in care through those analytics, right? And then when you think about, we've identified those, and then through digital services, we can then provide tools to the providers and care coordinators, right, so that they can actually go and close those gaps in care. And so what's happening is that not only is this possible in the traditional settings like hospitals and doctors' offices, we can do this in our 2,200 patient service centers around the country. We can do that in retail settings like our clinics, right, at Safeway and Walmart. We can do that at work, right? So we have a Blueprint for Wellness programs that we offer through employers, and those those screenings actually happen at their work locations. And then we can also we can also do it at home through our home collection devices. And all of those are connected through our Quest Quantum set of solutions and connectivity. And so what we're doing, it's a great point that you raised, right, is we actually, if you think about our provider portal, not only do we provide the provider with the results for their patients, we actually fold in the patient view as well. And so the provider sees what we also provide to that consumer to facilitate that they can interact and that, they can work together, right? Because at the end of the day, the consumer is getting more involved in managing their health, and the provider, so we are also facilitating that interaction and that communication as well.
Right, and it's really, based on kind of that comprehensive overlay that you just described, it's really also helping to drive care, prevention, and interaction beyond the traditional facilities and really bringing it to where individuals, live and work and do their daily activities. So it's, kind of hitting a lot of the common arguments in terms of what you need to do to succeed with a value-based care system.
Correct. And that's exactly how we see it, is that it's not just enough to provide the insights. They have to be actionable, right? And so if you think about the connectivity, right, and I think connectivity in terms of who we interact with, right, we have 5.3 million consumers that interact with us through our consumer portal, MyQuest. And so what's happening is that we're seeing not only an interest, but we're seeing our providers in our hospitals and care coordinators utilize our analytic solutions to make decisions. And we're also seeing the consumer getting engaged and, more knowledgeable and really accessing our services. But all of these I always think of it as a value chain, and then there's points of interactions that are happening depending on what is needed, but with the goal of identifying risk, getting you in to close those gaps, and then improving the quality of the patient's life on the one hand, but then at the same time driving efficiency, which is also another of the goals that we have in industry.
And for those of you just joining, I'm talking with Lidia Fonseca from Quest Diagnostics, and we've been talking about the shift to value-based care and making data available to everybody and getting people to act upon it, and kind of connected to that proliferation of data. I want to kind of change gears a little bit and go to an issue that you and I talked about when we've talked in the past a little bit, and kind of tap into what you might be able to share in terms of blockchain, which I think has been a big buzzword within healthcare, but I don't necessarily know if it's been well explained. So kind of as we move the conversation in that direction, I guess as a first step to help make sure that both myself and anyone who's listening actually understands it, would you be able to just give like a high level overview of what it actually is?
Sure. And I'll put it in very kind of simple terms. I would say, the way that we see blockchain as a cooperatively owned, synchronized, distributed ledger to collect, share, and exchange information. And blockchain is most useful, from our perspective, when loosely coupled organizations want to confidently and transparently share information automate mutually beneficial processes, and audit those interactions. So it really, so think of it as, imagine creating, and at first, we're targeting first provider data, right? So imagine that we create a golden record where we have the provider's attributes and we have it in a blockchain that all of us can access. And when somebody makes an update, that update not only increases the quality and completeness of that provider, record, but it becomes real-time accessible to the rest of us on the blockchain. And that's how we see, a blockchain, what it is and what it does.
So just to make sure I'm understanding correctly, so as you said, if one person makes an update, then everybody can see. So really, you're creating one centralized, distributed record, so everyone's working off of the same system, as opposed to even with optimistically saying we have interoperable electronic medical record systems. Right now, everyone still has their own EMR, but with a blockchain type solution, you could actually create one, as I said, for lack of a better way to say it, one centralized record where everyone is accessing the same thing, whether or not they're accessing the whole thing or just pieces of the chain.
Correct. And so if you think about it, right, today industry participants, right, typically collect provider demographic data, and they're in separate IT systems maintained by each organization independently. So like you say, by moving that to a blockchain, a distributed, synchronized blockchain that we all tap into and we all contribute to, then not only are we creating that, source of truth, think of it as, we kind of refer to it sometimes as kind of the golden record. That means that it's going to be as complete and as accurate, and then it's available to all of us whenever there's a change or an update.
So kind of with, I think that it would be hard to disagree that would be a very good goal. So what steps are you seeing are being taken to kind of get there? Because I've got to imagine it would be hard to just all of a sudden get to that ideal position immediately.
So, and that's, if you think about the alliance that we just announced, right, with 5 companies, right, you saw that Humana, Multiplan, Optum, Quest Diagnostics, and United Healthcare, we have come together and have formed this alliance. And, we are, and I'll tell you the first use case, right, is provider data. And what we're doing is we're actually, creating this blockchain, and each of us are, contributing and committed, right, to, number one, stand up the blockchain, so the technology piece of it, right? But also, we're contributing data to that blockchain, and we're also, committing to, as part of that blockchain and that common, that alliance, we are providing our updates, and we're creating, the setup so that we can ultimately improve the quality of that provider, the attributes and the data set. And as you can imagine, right, this promotes, if you look at the way things are today with everybody independent, right, today's world, there's a vast inefficiencies and duplication of efforts, as you can imagine, right? And it also, the quality of the data, because it's being siloed and maintained separately. And what we have found out is that from industry estimates, on that provider data, that one use case that we are piloting as part of the alliance as our first step, estimates indicate that $2.1 billion a year is spent across the industry chasing and maintaining this provider data. And we believe that through this blockchain, we can actually reduce that by 75%. And, the cost is one thing, but what's really important is that you really improve the quality of the data. So that improvement, having that single source of truth improves the quality of the data, improves access to care for patients. It streamlines the administrative burden, so it helps to reduce costs, right? And it relieves friction also between providers and multiple payers. And so we definitely see this as a good use case to start with. And this is one example, but we very much believe that blockchain, it really is a promising technology to address, interoperability, the quality of the data, and then we get, the better care and also, reduced efficiencies or increased efficiencies, right? Reducing costs.
Yeah, no, and that definitely, I think is, at least what I see in the headlines, the often described goal. And, if you're able to start moving down the road to that goal is going to be, have a very big ripple effect because, as you said, it's a use case. So if you can establish and show that it does work in this area, that allows you to build upon that experience and start really moving down to the ultimate goal, which, as you were initially describing, is kind of that unified record or the golden record, as you termed it, of the really complete picture of an individual.
Correct. And interestingly enough, right, because with the blockchain technology as it exists today, we believe that we can enable the use case I just described. And to me, this is going to be, to me, the technology is one piece of it. And, it's far enough, blockchain technology, that we feel, and there's 5 of us, on this alliance, we feel that it can enable that use case. Now, you couple that with collaboration between companies to share information across company boundaries. That's, to me, the unique and new thing about it. Because, the technology, I feel, is there, and certainly for the first use case that we have in mind. To me, what's unique and different and cool about what we're doing, in this alliance is this collaboration where 5, major companies are, not only willing but committed and excited about, sharing information and, really across company boundaries. And so, when you couple those two together, right, this promising technology and then this willingness and, to collaborate, it's, really makes a blockchain a promising enabler to improve the quality and completeness of the data, enable that interoperability, and then, in my mind, create a national critical infrastructure to speed up transactions and reduce friction. So we're excited about it, and we do believe that, this is, I think what's different is that collaboration, with today's 5, big companies that are major players in the healthcare space.
Yes, and as you're saying, that is, to date feels like a unique coming together of companies who, for the most part, are competitors, or at least potential competitors. Especially as you identified with United, Humana, and Multiplan all being insurers. You wouldn't necessarily expect them to be, as you said, sharing data across company lines. But kind of one thing that always puzzles me when off of what you're describing for the use of the blockchain, then when I've talked with others, is ultimately, does someone need to control the entire chain, or is it just that you worry about control and being able to provide access to individual packets on the chain, and then also where does it all end up getting hosted? Right.
So we're, like I said, our focus is going to be to set up, the pilot, and so our thought is that we're going to have this will be a cooperatively owned and synchronized, right, blockchain. So we as an alliance are, responsible for the blockchain. And what's really, the way that we're approaching this is all of us are contributing technologies and resources. And, as we think about the governance and the setup of this, we are, really approaching this as a cooperatively owned blockchain. And I think that's also part of how we're approaching this, because while right now, there's 5 of us that are founding members of this, frankly, right, our goal over time is that we want this to be available to, the rest of the industry, right? We're creating a community because ultimately to get at that golden record, you want to have more participants in there. And so, we will have, as an alliance, part of the work that we're doing is also setting up, an effective governance process, and that's all part of the work that we're doing.
Yeah, no, and actually I think that is very helpful to understand, because as you're saying, it's the collaboration is extending to all areas, and I think, as you were just saying, the real goal is to expand that collaboration and keep bringing more participants in as the use is expanded.
Correct.
So as we are unbelievably already kind of winding down towards the end of the time, what I'd like to do is ask you kind of one final question to get you speculating in terms of where do you think healthcare will be in the next couple of years? How quickly do you think some of these solutions will develop and help with the drive into value-based care and the other types of transitions into quality focus?
Sure. As I think of the next few years, and, we've seen that technology, has been accelerating, and, especially as more and more, the reach of technology, has extended, to consumers and in everyone's homes and wherever we go, right? So as I think about the next few years, I think population health, will increase the identification of patients at risk and gaps in care. And I think through digital technologies, we will intervene earlier, increasing the quality of life of the individual, right, while reducing costs. Intelligent agents will be more prevalent, increasing the access and interactions with patients. Virtual appointments, what some people call telemedicine, I think with doctors, care coordinators, and genetic counselors will be more mainstream. We already have some of those technologies. We offer some virtual appointments with doctors and our genetic counselors. So I see that being more mainstream. I think blockchain will enable transparent data exchange, speeding up transactions, improving data quality, and reduce some of the administrative burden. And so, as I think about, that over the next few years, we at Quest are really excited about this emerging technologies, right? When you think about intelligent agents, right, like artificial intelligence and machine learning. And we see it as a natural extension of our quantum solutions, right, that provide analytics, workflow tools, connectivity with the 650 EHRs out there in the market, and then very powerful, compelling portals, right, for consumers and providers to access insights so that they can make better decisions and outcomes. That's what we see over the next few years.
Yeah, just a couple things to keep an eye on, but believe it or not, we are out of time already. So I want to thank my guest, Lidia Fonseca, for a great conversation today.
Thanks, Matt. I enjoyed it and appreciate the invitation. Have a great weekend.
Yeah, and thank you to everyone listening. Keep the dialogue going and connect with me at #HCDEJURE. I'm Matt Fisher. Until next time.